when lives are on the line.
Are there any obvious injuries?
These men and women will risk theirs
The lad who was driving got blood coming out of his face.
to save yours.
RTC truck.
They deal with the most serious injuries.
The patient is described as bleeding heavily.
Directly below his ear.
There's a lot of blood there.
The most critical illnesses.
The reports of a male who's in cardiac arrest, and without any action, the patient will die.
The two Yorkshire Air Ambulances cover Britain's biggest county.
He's fallen 30 foot from the roof. Oh yeah. He's got a big cut to his head.
5 million people rely on them
All right, sorry, sweetheart.
to deliver cutting-edge emergency medicine
We're just going to go to sleep. He's not looking particularly good.
at high speed.
If you can activate your major hemorrhage protocol.
Every day brings high stakes.
He's gone forward to this person, the tractor's just rolled forward and he's ended up squashed between the wall and the wheel.
Yeah.
I know you are, Flower. We've gone to get a special blanket to warm you up.
High risks.
I've fallen right on the hip. Being outside in the cold with any sort of traumatic injury is not good for you. So we wanted to get him off as quickly and as safely as possible.
I can't even sit upright.
And high drama.
He was sat on the top of that roof when he slipped off.
Whereabouts is it worse? Just in your hip?
Same place,
Yeah.
We've got so many things that we need to know as part of our job that there's pretty much never a time really when we can't kind of keep learning and improve our knowledge.
It's the start of the shift at RAF Topcliffe, and paramedic Gemma is swatting up on the latest medical research.
We're always reading new things, new articles, books, anything just to keep us as up to date as we possibly can be to deliver the best care to our patients.
And now it's time to put the research into practice.
You all right, I'll get in?
Jump in, mate, jump in.
Helimed 99's being scrambled to the Yorkshire Dales, with Gemma, Lisa and pilot Owen.
Okay, so engines above the flight.
Flight engaged.
Yeah, doors, harnesses and stretchers.
Time, what's your front right?
Good in the back and we are good in the front.
We are clear right, minute 39. Bit of a drift to the right as always. Okay, so taxiway's clear, clear area departure.
Airdest 99 lifted.
It's freezing, and in the hills, snow has fallen overnight.
We've been called to Oswick, which is out past Grattington and Settle out in the Yorkshire Dales, to somebody that's trapped under a tractor. That's the only information we've got at the moment, apart from our air desk dispatcher, because he's listened into the call, and he sounds to be in quite a lot of pain. There's no other resources on scene as yet, so hopefully we'll get further updates before we get to scene. Air desk 99, go ahead.
Just for info really, I'm setting off 98 as well, just because it does sound like it might be a nasty job. I'm still trying to dig around and get an update and find out exactly how he's trapped and what the situation is. But yeah, that's as much as I know at the moment.
Our HEMS paramedic on the air desk today has just updated us. They've made the decision, having listened in further to the call, that they're going to send our Nostal aircraft as well, which has a doctor on board.
A farmer with his leg crushed by his own tractor is serious. And with 30 farm workers killed every year, speed is of the essence.
When we all arrived into work this morning, it was as low as -7, so and trauma and cold don't go together very well. It can interfere with bleeding and clotting and all sorts, but it's generally not a good thing. So we need to get somebody on scene as quickly as possible, start that clinical care and get the patient out of the cold and off to hospital.
99 from Air Desk.
Air desk 99, go ahead.
Quick update from scene. Sounds like it's probably a femur fracture. He's left the brake off his tractor and it's rolled over his leg. It's still trapped underneath, but I don't know if there's any sort of crush or anything.
Air desk 99, all received. He's still trapped. I'm presuming we've got fire to get him released though.
Yeah, fire are on scene and they're working to try and get him free.
Right, so it looks like that group of farm buildings there, doesn't it? Just on that little hillock or a little bit of a hill.
Just kind of to 11 o'clock?
I think you can see a fire engine, I think you can see a DCA.
Oh yeah, right,
Yep.
I can see visual, yeah.
Okay.
Yeah.
Yeah, so what I'll do then, the wind is from 12 o'clock now. Are we all happy in the back?
Yeah.
See where we're going? The top of this little hurricane is a bit flatter.
Yeah.
I know it's a bit further than seen, but it's a lot easier for us. Right, is any snow getting kicked up there, guys?
No.
I've got good markers there, that's all good. Have a feel for the ground now.
Oh, good.
Cheers, mate.
Happy?
I'm happy.
Unbuckle him.
Leave to the 3 o'clock, please.
Yep.
Local paramedics are on scene, but the man is trapped between the tractor and the wall.
Hello, George.
So he's been complaining of lower C-spine, upper thoracic pain. We've got pain to his sternum area when I've been pressing on it.
Right.
And the majority of his pain is down this right leg.
Okay, so he's gone forward to this post and the tractor's just rolled forward and he's ended up squashed between the wall and the wheel.
Yeah, but he did say to me that it's gone over him. But
right. And he's been in this position ever since you seen him?
Lower down. As soon as I came, he grabbed on my leg and pulled himself up.
Right, right, okay. So has he managed to move then? So his chest hasn't been trapped?
He's sat himself up while holding on to me.
Right, okay.
Firefighters are working to release 85-year-old George Horton.
If we can get some enough pain relief in him, we should be able to move him now.
Gemma, will you get us Gerritherm, please? Yeah.
Lisa's first priority is to warm George up, using a Gerritherm, a specialist heated blanket.
George? Where are you? Let's have a look at you. Hello, George. My name's Lisa. I'm one of the paramedics off helicopter. Where are you hurting?
My legs, it's run over my ankle.
Right, okay.
Wheel run over my back.
It ran over you. Has it gone over the top of your chest?
Tried to come forward. I don't know what they're
Oh dear, all right.
George's right leg was run over by the tractor, which then pinned him against the wall. Thankfully, the tractor stalled before crushing him further.
What about round here?
They're all right.
Does that feel okay?
Yeah.
That
Just my ankle in my back.
What about your chest?
That's all right.
Does that hurt?
Just a bit.
Right,
No, not too
okay. All right. I know you are, Flower. We're going to get a special blanket to warm you up. Right, we'll get some obs and then try get something a bit stronger drawn up for him.
The second Yorkshire Air Ambulance is arriving, with the doctor on board.
He's complaining of his right ankle and he's complaining of C-spine. So we're going to get him out on longboard once I've got a full picture. So I'll just have a little listen. I'm just going to have a listen to your chest, George. Have you got any problems breathing? Nice deep breath.
So he's currently kind of on the floor between the tractor and the fence post, which is making it a little bit difficult to assess him. So we're going to put him onto a spinal board, drag him out, and then we can assess him a little bit better once he's out.
Are you all right, George? Cold, I'm cold, but you are.
So it sounds like he's got a bit of reduced air entry at left side. So we could just do with getting him out and have a proper look.
George's breathing is a concern for Lisa. She's consulting Dr. Johnny about his treatment.
Right, so my plan is going to be plan A to just try assist him up, see how we fare with that. I haven't really been able to properly assess the pelvis because of how he is and where he is. So we'll need to be really careful while we're doing it. And if we're not happy, we'll pop him back down. Plan B is get the longboard, slide it under his bum and pull him forward and get him out. Is that okay?
That's absolutely fine, yeah.
Cool. Should we give him a bit of ketamine now just to help us get him across? So when we get him out, we'll do a quick top to toe again and we'll have another listen to his chest. I think he might have reduced air entry left side, lower. So if you won't mind doing that, I'll have a look at pelvis and just double check everything else.
Lisa is waiting for the painkiller to take effect. Crush injuries can be fatal.
We'll start moving at that in a minute while he's got the effect of it.
Going funny.
Yeah, that's some medicine we've given you. It's perfectly safe, George. Right, guys, is everyone ready? On my set, ready, steady, lift. Brilliant. Everybody happy? Yeah.
At last, George is free of the tractor wheel.
Right, we'll just do a quick exposure, Gemma.
So you've got an open fracture of the right ankle, guys. It's going to be a bit sore. He's got some deformity here and it just needs bandaging.
Right.
George has a bad ankle fracture and possibly a pelvic injury.
Gemma, what did you think to his chest?
I had a good feel around it. There wasn't anything untoward externally, but listening to it, I can't hear anything because he was making that noise.
Right.
Gemma and Lisa still have concerns about his chest too.
Ready, steady, lift. So we're just going to take back at ambulance. I'm thinking he's going to trigger step 2 to go to a major trauma centre if we can't hear anything in his chest.
Yeah, I mean, we can't rule it out, can we?
No.
This job has been a bit close to home for one of the firefighters.
He's actually my uncle, and it looks like he's got off the tractor and either the tractor's jumped into gear or he's caught the lever when he's got off on the transfer box, and it looks like he's strapped him against the gate.
Has his sets come up yet, Gemma?
No. Got good chest expansion.
Yeah.
Just can't hear out in bottom of that left-hand side.
Okay.
Which would tie in which side that we're nearest to tractor.
Yeah.
So I think we should just get this pelvic binder on, try get some of these clothes out, and let's just go.
Because of their concerns about his chest, which could be a sign of serious lung problems, George needs to be seen at a major trauma centre.
Hiya, it's Helimed Air Ambulance here. We've got an 83-year-old gentleman called George complaining of central neck and back pain, query reduced air entry lower left side of his chest. He's got quite a nasty laceration, open fracture to the right ankle area. He's had a gram of IV paracetamol, he's had 6 milligram of morphine, he's had 20 milligram of ketamine.
So we need to basically just put him in head first.
And we'll be with you in about 15 minutes.
All clear, left please, mate.
Clear left.
George's crushed ankle will require surgery, and until he's x-rayed, the team can't rule out life-threatening internal injuries. He's being flown to the major trauma centre in Preston for urgent tests. Temperatures across Yorkshire have been below freezing for days. Paramedic Rachel knows that getting through the shift ahead will be all about the layers.
It's not unusual for you to see me walking around Topcliffe Base with like 3 coats on. So I'll have my gilet on, which I've got on underneath here at the moment, which is just like a body warmer, just to keep the main core of me warm. Then I'll have my own coat, which is like a really good one at like keeping you warm. And then I'll have my fleece over the top with my hat on, my gloves, because I don't do well in the cold. I am always cold, so to be cold as well just don't make it particularly pleasant.
The scramble phone is ringing.
You are going west of Moulton.
Dispatcher Sammy has a job for the crew.
59-year-old male, cruelly fractured hip whilst out walking. The track, you may get a DCA to, but they're 35 minutes out.
Rachel is on board Helimed 99 with pilot Colin and paramedic Matty.
Dash from 99, we've lifted Topcliffe route into this incident, over.
99 lifted.
Oh, I'm already shaking, I'm that cold.
Oh, let's put some heat on, shall we?
We're heading out to a walker who's fallen whilst out. I think it might potentially be a little bit difficult access for a DCA, that's why we've been allocated by Sammy down on the air desk. We haven't got any more information from other than that. He may have hurt his hip. It's absolutely freezing today, so he's going to get cold very, very quickly. So the longer he's on the floor, the worse it's going to be for him. So hopefully we can get there. If anything, get him up, get him warm, keep him warm, and then hopefully get him to hospital.
The temperature outside is around -3, with the wind chill making that even lower. In trauma cases like this, the cold can be fatal.
So it's down here on the right. Got a car down the bottom there somewhere, and a few houses.
Should get a DCA to that, we have.
I've got somebody on a path, but they're not waving. And they're just behind that white car, down there on the track. Yeah, the corner of that field. Do you want to come out just to the right here, do you? That looks a bit easier than down the track. Yeah, actually.
Watch those wires, Colin.
Yeah. Super. We'll just put it here, shall we? Then you straight down the road. All good on our left, mate. Thank you. A little bit of slope of ground nose down by the looks of it. Okay, put it down.
Hello. You all right?
59-year-old David Barlow was out doing his daily walk with his partner Jan when he slipped on the ice. They were just 15 minutes from home.
So, what have you done to this morning, this afternoon even?
So get him out cold.
I've fallen
Thank you very much.
right on my hip.
Right on your hip?
Right on my hip.
Yep. Did you feel anything, hear anything when you landed?
A crack.
A crack?
It was a loud, well, it might have been a crack, but it was that kind of noise.
Right, okay.
I can't even sit upright.
All right, okay, fair enough.
And when I try and lie back, it's just agony.
Okay.
I've just asked the guys just to get the stretcher, we can get him straight off at cold floor then.
Yeah, shall I get him to grab the Entonox as well? Because he'll probably need that for moving.
Rachel's going to come back with some laughing gas, some Entonox. It's really good for bony type pain.
Yeah.
Just till we facilitate moving you, then we'll give you some really strong pain relief. All right, mate?
Thank you.
All right, mate. This might make you feel like you've had a couple of shandies, okay?
Yeah.
You bob it in between your teeth and suck on it like you're sucking on a straw, okay? So that's it.
And I say if it does make you feel a bit woozy, that's normal, okay?
That means it's doing its job.
Rachel and Matty know they can't waste any time getting David into the warm. If he's bleeding, the cold could stop his blood from clotting.
We're just going to put this hard board behind you to roll you onto it. It's the quickest and safest way to get you off the floor, okay? We'll put you straight onto our stretcher and we'll get you into the ambulance, my friend, okay? And we can have a real good look at you there.
So just bear with us, because this bit's going to be the most uncomfortable bit, okay, while we get you over. Hopefully once we've got that little bit of pressure off your hip, it won't be quite as uncomfortable, yeah? Right, bob that back in, sweetheart. Take some nice deep breaths. We'll have 2 or 3 really good breaths and then we'll move you, all right? That's it. Right then, David, when you're ready, sweetheart, we're going to roll you onto your back, all right? That's it.
All right, my friend. You can carry on taking those big breaths. That's it. Nice big breaths, mate.
I wonder if I maybe get under this leg. Yeah. Just try and help him across.
Nice big breaths, buddy. Good.
Just keep nice deep.
I got it. Nice big breaths, mate. Nice, slow, deep breaths. Absolutely brilliant, my friend. Well done, matey.
Have you got pain in the arm, David? What? Have you got pain in this arm?
No.
No, just your hip. That's it.
Well done. Deep breaths on that Entonox.
The team suspect a break at the top of David's femur, the longest bone in the body, and the most painful to break. It's no wonder he's distressed.
I'm so sorry.
No, it's okay, David. Breathe this gas in, my friend. Good, man.
Right, that's the hard bit done.
Yeah, everybody happy?
On lift then. Ready, steady, lift. How do you feel now you're off the floor?
It's obviously just my left hip.
Just your left hip.
What a time to do this.
With David in the ambulance, Matty and Rachel can assess him out of the elements.
David, we're going to have to strip you off, sweetheart. I know you're cold, but we'll get the heating on, all right?
It looks like he's broken his hip, okay? So what we're going to do is we're going to treat him for a broken hip.
Okay.
Like I just tried to explain there, being outside in the cold with any sort of traumatic injury is not good for you. So we wanted to get him off as quickly and as safely as possible.
Okay.
He's in our office now, it's a lot warmer, we can cut his clothes off and have a good look at him. If we do that out here, it's going to make him a lot worse, okay?
Yeah.
So we've given him the gas and air just for a little bit of pain relief. That's only like mild pain relief. We're going to give him some really strong stuff now, okay?
Okay.
And then we'll probably pop him to York Hospital.
Right.
Okay?
David, take his boots off your left leg, all right? And support your leg for you. There we go.
Do you want some more of this Entonox?
There we go. Did you just slip on the ice then, David, and go down?
Yeah. Small scratch, David, on 3. Right on it. Right on the hip bone.
Did you hear it then when you went down?
Yeah.
Air desk, medic 1.
Medic 1, catch your message.
Hiya Sammy, yeah, we've literally just scooped this gentleman off out of the snow into the back of a DCA. He's had some Entonox. Looks like he's got a left-sided neck of femur fracture. He's got obvious shortening and external rotation. We haven't stripped him off properly because it's absolutely freezing. We're just trying to get some pain relief on board and I'll update you further, over.
David, I really need you to relax this right arm now, sweetheart. Nice and relaxed, nice and floppy.
He's fairly stable, all his observations are okay that we've taken. Rachel's managed to get a really small cannula in, so the gentleman's now having some really strong pain relief. He's having some IV paracetamol, he's had some morphine. He's also had some anti-sickness medication because it's going to be a little bit bumpy on the way in with these icy roads. So yeah, he's nice and comfortable now. The main thing is he just gets hospital and has a quick x-ray, see if he has actually fractured his hip, which it does look like he has done. and then he'll need some input from the orthopaedic team at York.
Right, David, take care of yourself, sweetheart.
Thanks ever so much.
All right, and I hope you have a speedy recovery.
Thank you.
All right.
The weather conditions mean David will be driven the 14 miles to A&E in York by road. He'll need surgery on his hip. Last year, the construction industry saw more deaths than any other profession. 40 people lost their lives in the UK. Nearly half of those accidents were falls from height. And today, the team are being tasked to help a builder who's fallen 10 feet.
Right in the middle of town. Is it? Well, nearly. Fallen off a roof. Okay. Clear right? Clear left. Clear left. 15. That's from 99. Ty, can I just see if you've got any further information and just confirm location as well, please, Dora?
The patient is conscious. He's fallen off a roof with chest and hip injury.
Pilot Colin is flying paramedics James and Steve 20 miles on board Helimed 99.
If it's a fall from height, obviously the main concern will be spinal injuries, a head injury. He could fall something like onto his pelvis or onto a long bone. All things that, areas there that could bleed into quite sufficiently. So, again, it's important to get there to discover if he is bleeding. Thinking about things going through my head now is, things like TXA and things like that, or splinting bones that could be bleeding into, or possible open fractures.
Their patient has fallen in the medieval city of York. Colin's using his local knowledge to find a landing site.
Oh, follow the railway line to the railway station. Down to the railway museum, we turn right, and then there's like the row of terrace houses, a school and some open areas, so we've got to identify it there. No worries. DCA, 1 o'clock. Visual, 1 o'clock now. This school fenced? It looks fenced, doesn't it? It looks like one of those green anti-climb ones. Yeah, it is. Yes.
He's homing in on a school playground.
These football posts look like they could fly away, Colin, just so you're aware. Yeah, I'm just keeping the height up this side here. Got one to the right, 2 in the 12. Goalpost is stationary to the right. Do you want me to jump out and go ask them if they can let us out the gate? Yeah, might as well. Before you shut down, yeah?
Thank you very much. Thank you.
100 metres down the road, their patient is in the care of ground paramedics.
Hello there. Hello there. Hi, my name's Steve. This is James. What's happened?
He has been working on that roof, about
8
foot high. He was sat on the top of that roof when he slipped off. He's landed on his left-hand side.
Okay.
In a lot of distress when he got to, so I've given IV 10 mil of morphine and a gram of paracetamol. Which is
Okay. Okay, Alfie, just breathe normally for me, nice in and out.
Hey, pain and stirred the hip.
That's okay.
Yeah, it's stirred the hip.
All right, sorry about that.
54-year-old Othie Sykes was working on the house with his son-in-law Hope when he fell backwards off the roof.
He was at the top repainting the ridges and replacing all cement and whatever, taking the old put no in. And he was sat on it and it went back too far. Anyway, I was meant to take a phone call from the bank, and as I went to take the phone call for the bank and walk from there to there.
Any pain in your legs here, Alfie?
No, just in the butt. It's been okay. Taking my ass,
I think he's smashed all this. I think he's smashed all, like, this part of his body.
Right, Alfie, I'm just going to cut through some of this gear, okay, so we can have a little look at your hip, my friend, okay?
So he's had 10 of morphine.
And a gram of paracetamol.
Gram of paracetamol, okay.
As my father-in-law say, I'm married to his daughter, and we're working for a while by me here, and it's just one of those things. Like, accidents meant to happen, and it happened.
I'm happy with his chest, so we can have some Entonox. So can you just go and grab Entonox for us? Perfect. The femur looks all right, doesn't it?
Yeah, femur felt fine. So is it round the back here where your pain is?
From there now down to,
down to your bum.
The Entonox, or gas and air, will relieve Othie's pain while James and Steve prepare him for his journey to hospital.
So I think it's a case of stretcher out and then we'll get him onto the scope. We're going to draw up some more morphine, Alfie. Just keep going on the Entonox in the short term, OK?
The location of Othie's pain could indicate a broken pelvis. It can lead to lethal internal bleeding and damage to internal organs.
Keep going on the gas in here the minute.
Worcesters have been taking the gas, mate.
It's worse.
It's worse?
Yeah.
Whereabouts is it worse? Just in your hip?
In the same place, yeah.
Yeah, no pain anywhere else, though?
No.
No, OK.
The team are using a scoop stretcher. It's specially designed to move trauma patients, lessening the risk of bone fragments causing further injuries.
Right, Alfie, you keep taking that. It's your best friend for the next few minutes, okay? We're going to go on slide, guys, okay? 1, 2, 3, slide. Perfect.
As he has a suspected pelvis fracture, the team will be flying him to the nearest trauma centre.
We're looking like we're probably going to go to Leeds. He's had 20 milligrams of morphine. At the minute, he's hemodynamically stable.
The good news is Othie's blood flow is stable, but his injuries are severe.
Yeah, we've just arrived at the school. We're going to load this patient on. If you can contact LGI for us.
It's a 10-minute flight to Leeds General Infirmary.
So obviously it's a priority to get there, give him a good trauma assessment head to toe, before we get that assessment done quickly to discover if he has any life-threatening injuries.
Othie will need emergency surgery.
Freelanders, doors, harnesses and stretcher.
Close the secure front right. Yeah, all secure in the back.
And close the secure front left.
Orthopaedic surgeons are on standby for his arrival. He could be in for an extended stay.
The top of tower start, runway 20 right hand, QFE 1018.
It's an icy morning at RAF Topcliffe, and paramedics Andy and Pete are preparing for a cold day.
First thing in the morning when we come on is prep the aircraft, so we have all the checks, the aviation checks to do, but all the clinical kit that we've got on board as well. It's going to be a cold day today again, so some of the equipment that we don't use perhaps that often, like the heating blanket, we need to make sure that's fully charged. We have our Flecton, which is a very large sort of sleeping bag that we encase patients in, and those type of things can make a big difference, as well as the clinical interventions that we have.
The first job of the day soon comes in. Pilot Harry will be flying them to a town on the edge of the Yorkshire Dales.
Okay, Richmond.
Richmond, yeah.
We'll lift and go out to the right there. Turn left round the hangar back into wind. Turn left once to get down the corner, that'll put us more into wind.
Looks like it's on a residential street, this. Okay.
Heavy snow has been falling in parts of North Yorkshire over the past few days. The plummeting temperatures could add an extra complication to this emergency.
We're just on our way to North Yorkshire. It's quite an icy morning again. We've got reports there of an elderly patient fallen in the street and sustained a lower leg injury. But the call has reported that there's an open fracture and it's badly displaced. So there is a crew attending, and we've been sent to see if we can give some additional support. If you've got an open fracture, then there's a huge potential there for increased infection within the wound, which can delay recovery. And then we've got the added problem at this time of year that hypothermia to set in with the patient as well.
So there's our school. Yep. There's that patch field next to the big long building, isn't there? Yeah, that's pretty much where...
Got DCA, have you got it low at 2 o'clock, Harry?
Yeah, visual, yeah. Okay, so wind's on just to the left at the moment, so we'll come back round a full 360 to land where there as discussed. What I'll do, Pete, is I'll just go and land up this top end near that gate if I can, because then if we need to convey, the DCA might be able to get quite close to us.
Yeah, okay.
It will depend on the slope, but if I can, I'll put us there.
Okay.
Yep. Upper motor out. Okay, snow's holding firm there.
Moving.
Yeah, just going to bring us a little bit round to the right there and take us up to this corner. That seems pretty good for limits. Yeah, that's well within limits as it settles into the snow. Right, yeah, that's all good. You're clear to unstrap. 9-9 landed.
Pete now faces a tricky walk in the snow to where the accident happened.
Unfortunately, due to it being in a sort of residential area, we've had to land in a field on outskirts of town. So we're just making us way down, made a bit more hazardous by obviously the standing ice and snow that's still around.
Pete's patient has been taken into a ground ambulance by local paramedics.
Morning. How you doing? Good. Just come in and shut that door.
Val, 83, 9:30. She's fallen across the road there.
Yeah.
Isolated, left fracture, distal tip fib there. She's tried to walk with assistance on that across the road.
Right.
83-year-old Val Warner was walking across the road to her home when she slipped on the ice. It was her first time outside the house in months.
Hello Val, how are you feeling now? Just cold, which been like pain-wise then, are we?
Hard to give her, she's in agony, bless her, but she's not giving a pain score.
Yeah. How is it feeling for you at the moment?
It's just hurting.
Just hurting.
Val's neighbour saw her fall and called over her son Michael.
She was taking a card over to Miss Buxton here. She was on her way back and she just slipped on the ice. So they came out, tried to get her over here, but then she stopped here. She said her ankle was broken. By the time I got here, she was already in the ambulance.
Are you able to move these toes for me?
I can move them, but it hurts.
It hurts. If I just touch down here.
Feel it.
Great stuff. And here?
Feel it. Yes.
Can't believe it, really. They've been shielding for months and months, you know, with the virus.
So, your thoughts on that? So we have got peel.
Yep.
Obviously we've got.
Yeah.
What? Yeah.
Alright.
So I wasn't going to pull that.
Yeah, she's got a pedal pulse
Yeah.
and she's got sensation.
And we've just said so.
Yeah. Pain level at the moment.
She's in a lot of pain.
Yeah.
A lot of pain. Yeah.
A bit more settled than perhaps she was. She's had 2.5, so it's the second 2.5 going in.
Yeah.
Pete is concerned that Val's age could mean she's at a high risk of a serious infection. They need to get her out of the cold to hospital.
You need new central heating.
Say again?
You need new heating.
How long have we been outdoors for?
Maybe it's quarter of an hour, 20 minutes. On
Right.
Ice and snow.
Yeah. Fine. Sorry about that.
The team are dressing Val's ankle for her journey.
So our plan is to actually take you up by helicopter to James Cook. Because of the time it's going to take you to drive and because of the injury you've got, we don't want to bump you around any more than we have to, okay? Medical background with this lady. Look.
Didn't get it. I'm a colleague might have got it.
Fit as a fiddle, yeah? As far as recently, you've not had any new coughs or anything? And,
No, I had my vaccination last Thursday.
Did you?
Yes.
How did you feel after that? Were you all right?
Fine.
Yeah, great stuff.
The helicopter flight will save Val a long, bumpy ride to Middlesbrough in the back of an ambulance.
Val's got an isolated injury. It's quite a nasty fracture and it's going to need surgery. As it is at the moment, thankfully, we don't need to relocate it. She's got good sensation and pulse beyond that. But obviously, it does need attention in hospital. The guys here have got a 45-minute drive to hospital, and that's providing all the roads are clear. So the plan is to transfer Val across to the aircraft and give her a much smoother and quicker flight into hospital. And she suffers arthritis. She's had lots of sort of surgery in the past, knee, hip replacements, shoulder replacements. So, you know, I think this is going to be quite a serious injury for her. On your call at top, guys.
Ready.
Good morning, it's Pete on Helimed. We're bringing your patient in from Richmond. Can I pass you some details, please? We've got an 83-year-old female. She's fallen on ice and she's got a isolated lower leg fracture or ankle fracture. We've not tried straightening it out because obviously it doesn't look compromised at the moment. Everything else is fine. It's just trying to get some analgesia into her and we'll be with you in about 20 minutes.
The team are familiar with the dangers that snow and ice can pose.
Although most of the snow has cleared in most areas, certainly up North Yorkshire, there's still patches where it's treacherous really. From us leaving the aircraft and getting down to the patient, it was very slippery underfoot. And it can be quite deceiving because you think it's clearing and then there'll be a patch of ice. And I think this lady, she's managed to get out, she's visited her neighbours to deliver a birthday card. And it's just on her return back, she's slipped at her back door. She is very active, and it's probably by being active today and being out has actually caused the sort of downfall, which is a great shame when people, you know, are out and trying to get around and do as best they can.
After months of shielding from the virus, Val now faces hours of surgery at the James Cook Hospital, the result of her first trip outside her home since lockdown. It's February, and heavy snow is falling across Yorkshire. At RAF Topcliffe, paramedics Lisa and Gemma are getting warm between jobs.
He says, how's out towards Thornton le Dale looking?
Thornton le Dale? Yeah, should we come around the edge and up into it?
With pilot Colin giving the go-ahead to fly in the snowy conditions, the team are setting off on a job.
Right, don't like it, we'll turn around and come back. It's just northwest of Leeming Mats. We've got the A1 to follow. I don't think there's too much to worry about on the way up there.
If conditions worsen, they may not be able to reach their patient.
Yeah, it's all very wet now, isn't it? Like I say, temperature's positive.
Eyedrops 99, we've lifted.
DCA is signed to it, they're showing 4 minutes away.
Okay, we're going to be about the same time then.
The only thing, no further update on the patient is yet. She's fallen from the horse, couldn't feel her legs from the waist down.
A professional rider has come off her racehorse. The weather makes her situation even more precarious.
There's been a little bit of delay for us dispatching. The ambulance will take a little while as well. Obviously it's a snowy day and this patient has fallen a little bit of time ago, maybe 20 minutes ago now, so she's going to be really cold, whatever injuries she's got, so we need to bear that in mind and try and assess her as quickly as we can and move her.
Got the A1. I might follow that up actually because it's a good visual reference.
Are you happy with this?
Well, we've got 600 foot cloud base, so if we don't like it, we can come down.
The snow is getting heavier, making visibility worse.
Closed in a bit, hasn't it?
Yeah.
Yeah. We're just going around a shower.
Yeah, that's fine.
Are you happy with it still?
Well, I am, because I've still got references and it's patchy stuff.
Yeah. So it should be just out to our 11 o'clock somewhere. In fact, I think it's just this on the nose.
99 from Eyedrops. Just spoke to the crew. You need to be about a quarter mile south. It's on a main road towards Hackthorpe.
Possibly that road over there?
Yeah, it might be mine too.
Is that the DCA there at about 1 o'clock?
Yeah.
Gully.
Good spot.
Oh yeah, people in that field as well on the right.
Yeah.
Don't go in the trampled area just slightly south of there.
Now we've found the crew visual for landing.
Might as well just put it on these tracks here, I think.
Yeah. You're all good left. You're getting a bit of a white out.
Kicking up. Got the references.
Good left. Good right. Eyedrops 99, we've landed scene. So we weren't really sure whether we'd actually get to scene, but we managed to sort of beat the bad weather and trek around the snow showers that were coming in. And you think that a bright yellow ambulance would stand out quite well in the snow, but when you're 500 foot up above or even a bit more, it's just quite tricky against the white background to get your landmarks that you normally would get.
Their patient is lying in thick snow. Lisa and Gemma will have to work quickly. Cold can be a killer in trauma cases.
Hi guys. So this is Phoebe.
Yeah.
Fallen off the horse. She's gone. She's sort of fallen off on her legs and then gone down.
Okay. Where are we with anything else? How's she doing with pain?
Pain. It's just all in this leg.
Okay.
Breathing shed was fine. She doesn't think the horse has stood on her.
Okay.
Yeah.
Phoebe, hello. I'm Gemma. How are we doing? How's that pain?
Yeah, it's
It's hurting. Okay. And pelvis is.
Down through the legs.
Yeah, and everything was all right.
20-year-old Phoebe Robinson works with racehorses. She was riding one out today when the horse got spooked and knocked her off.
What caused you to come off, Phoebe?
The horse in front kicked out and mine
just didn't like it.
Yeah.
I think we have been going to more and more what we call horsey jobs of late because people's social facilities and things are very much closed down at the moment, so you're limited what you can do to enjoy these strange times.
Not allergic to anything?
Penicillin.
You're allergic to penicillin. Have you had any pain relief today for anything?
No.
Because we want to get you out of the cold, can we just delay putting anything in your veins and then we can just get you to the ambulance? Is that all right?
I'd rather be warm.
I know, I thought you might, yeah.
But you've had better days, haven't you?
Yeah. It had to be a snow day.
So, we're going to go on lift. Ready? Brace. Lift. Nice and steady, just slippy. All right, Phoebe?
Yeah.
Gemma wants to give Phoebe pain relief and check her over. But the first priority is to warm her up.
Get fire on her.
Yeah. Get the log burner on.
Oh, if only. Maybe a hot tub.
We'll just come out.
Desk Medic 1.
Patient's GCS 15. The crew had already got her packaged on a scoop. So we've got her off the floor, into back at DCA. We're going to do a top to toe and then decide. I think we're going to struggle to fly anywhere.
The snow is making an already difficult rescue more complicated.
When we left this morning, we had 800-900 foot cloud visibility. Of course, now that it's been snowing a bit, the danger is that we're going to get settling snow onto the aircraft, so I'm going to have to go out and run it to clear all the snow off. A difficult day.
Phoebe, we're just going to put a splint on your lower leg because it just looks a bit swollen around your ankle. Yeah. So it should just kind of help it settle in a position, if that's all right.
It looks like it's just a lower leg injury, which, although it will be painful, it could have been a lot worse. So all our observations are in normal range. So today we won't be flying, she'll go by road to the local trauma unit, which is Darlington.
It looks like Phoebe, who's been riding for 16 years, has had a lucky escape. But she won't be saddling up for a while.
Go quite nice on the next Christmas cards, that shot.
The air ambulance team must return to base before the weather turns again. At hospital, it was found that Phoebe had damaged ligaments in her ankle, but she was released later that day. She spent 3 weeks recovering at home, but is now back at work training racehorses.
I'm cold.
I know you are, Flower. We're going to get a special blanket to warm you up.
George, the farmer who was pinned against a wall by his tractor, needed skin grafts and 2 operations to pin and plate his ankle. He's thankful to the air ambulance team, who he says saved his leg.
Hello, Val. How are you feeling now? Just cold.
Val, who slipped on ice during her first outing in months, fractured 2 bones in her leg.
The leg bone came out through the side of my foot, and you could see the bare bone, and then the ankle was twisted completely.
She had surgery and is slowly getting back on her feet.
At the operation, they pinned and plated my ankle. Afterwards, they put me onto a walking frame, and they said because of my age, crutches weren't very good. And I've been pottering around on the walking frame ever since.
She knows that day could have been much worse and is grateful for the paramedics' help.
I keep thinking, what if somebody hadn't seen me fall, and how long I would have laid on the ice and snow. I'm just so thankful somebody saw it.
He was sat on the top of that roof when he slipped off.
Othie, who fell 10 feet off a roof, had a broken pelvis and ribs.
You can still take the Entonox with that hand?
He had surgery to pin and plate his pelvis and was unable to walk for 3 months. He's been a builder for 40 years, but has taken a break from it for the past few months.
I've fallen right on my hip. I can't even sit upright.
David, who fell while doing his daily walk, broke his femur in 3 places and had a 9-inch pin put into his leg. He's still recovering, but hopes he can walk his usual route again soon. When lives are on the line,
Are there any obvious injuries?
these men and women will risk theirs
The lad who was driving got blood coming out of his face.
to save yours.
RTC trap.
They deal with the most serious injuries.
The patient is described as bleeding heavily.
Directly below his ear. There's a lot of blood there.
The most critical illnesses.
The reports of a male who's in cardiac arrest, and without any action, the patient will die.
The 2 Yorkshire Air Ambulances cover Britain's biggest county.
He's fallen 30 foot from the roof. Oh yeah. He's got a big cut to his head.
5 million people rely on them
All right, sorry, sweetheart.
to deliver cutting-edge emergency medicine.
We're just going to go to sleep. He's not looking particularly good.
At high speed.
If you can activate your major hemorrhage protocol.
Every day brings high stakes.
I'll bring the autopulse and we can put him on the autopulse, all right?
He just made a funny noise, collapsed off his back, did CPR and everything. Without them, he'd have been dead, I think.
High anxiety.
A 9-year-old boy's got some super glue in his eye.
Can you open that at all now? Try it in. It's the eyelashes stuck together, aren't they?
And high risks.
Circular saw, it's hanging on by the skin.
The wood bounced and it took the saw out of the groove.
There should be 3 batteries there altogether.
Every year, the air ambulances must go for an annual service. And today, at RAF Topcliffe, paramedics Steve and Gav are getting used to a borrowed helicopter. Steve's making sure that one vital piece of equipment is ready to go, the autopulse, which gives chest compressions automatically.
So this machine doesn't replace the quality of CPR. What it does is it gives it consistently all the time. So where people out there can tire, this machine will not tire. It will do it at the same rate, the same depth. And actually the band is very good. It goes around the circumference of the patient, so it works out exactly what depth it needs to go. So it's a brilliant piece of kit.
And it's not long before they're being scrambled. It's a mission on which the autopulse could be a lifesaver.
Looks like it's a cyclist, Steve.
Okay.
Beat cycling, claps to floor, CPR progress.
Okay. ARS 98 lifted from Topcliffe. Put eyes in, Harry.
Yeah, Roger, eyes out.
Pilot Harry is flying them the 26 miles to Ilkley.
It's near the golf club on the single road.
Effective CPR more than doubles the chance of someone surviving a cardiac arrest.
Pyramid 98 Alpha letting down at Ilkley.
Bystanders are buying time for this patient until Gav and Steve arrive.
There's a golf course out there to the right where the bend in the river is. Is that an ambulance to your 1 o'clock, Harry? Visual travelling. Yeah, visual now, yeah. Okay, right, skid up. Just coming up the hill a bit for a bit of flatter ground.
Okay.
Okay, leave us fully down, you clear out, go. Thank you.
ARS 98 landed on the scene, over.
They're joining a desperate fight for the patient's life.
Steve, can you bring us the autopulse forward, please? Hi, guys. Hiya. Can you bring the autopulse forward, please? Where are we at, guys?
Craig Parker's heart is fluttering uselessly in his chest.
You have 1 shot, okay, yep. What's the rhythm at the
CPR is keeping oxygen flowing to Craig's brain, but it's tiring.
Got adrenaline now.
Even experts slowly become less effective at keeping the blood pumping around the body.
Yeah. What's the CO2 like at the minute?
The autopulse doesn't.
CO2 1.3, that's great. Keep going, well done, mate. We'll stop her. I'll bring the autopulse and we can put him on the autopulse, all right? Yeah. So is this first adrenaline going in?
Just have 1 now.
1 adrenaline. Okay.
Craig Parker was out for a ride with a group of friends when he collapsed. Shockingly, he's just 48. His brother Darren was with him.
I just didn't know what to do. I had cradled him in my arms and everybody else stopped. And they basically took over and did CPR and everything on him. Without them, he'd have been dead, I think.
Has everyone seen the autopulse used before?
No, I haven't.
Right, so what we're going to do is we're going to sit him up, slide him under, and get on, that'll take over CPR.
But just as he's about to be put onto the autopulse machine, there's a breakthrough.
Check. I've got a pulse. He's making it to breathe.
Perfect. Right, let's ROSC that. Time at 55.
Craig has had a return of spontaneous circulation, a ROSC. His heart has started beating again.
And I still think we should get him on the autopulse.
Yeah, in
case he re-arrests, all right?
I agree. Let's do some more. Let him settle a bit first.
Yep.
And then we'll move.
Lateral tilt, get him on there.
Get him in.
We're going to sit him slightly forward. We're going to slide the autopulse under. Okay, ready, you, Steve, when you're ready.
You've got it,
I've got it, yeah. Okay, up. Keep going in a bit more.
But Gav and Steve know that Craig's situation is still critical.
Hi there, I'm Gavin.
Hi,
okay,
Gavin.
Your brother now he's actually breathing for himself now. We've got his heart going again, so whatever has been done, Pat, has been brilliant. He's still
he is still very, very poorly, okay? And there's a possibility that it might stop again on our way to hospital, but we're going to get him to LGI, okay? Can you just give me any, has he got any medical history? Has he got any heart problems, anything like that you know of?
No, it's just cholesterol. I know he's got very high cholesterol.
High cholesterol, that's fine. So he'll take some statins for that, I would imagine.
Down the bottom, we stopped and he had a cigarette. And he said he got a bit of out of it.
Right, okay.
Gav is trying to piece together the events that led to Craig's collapse. It could be crucial to hospital doctors in deciding how to treat him.
We were just riding from Skipton, we came through Ilkley at the bottom, came up the road, we were talking, he just made a funny noise and then just went sideways and collapsed off his bike and he's never recovered since.
He said he had heartburn.
Right.
And he just came up here and just fell off his bike.
Fell off his bike, so he's just straight away,
We just came, it just literally was sat up and then he just went...
That's it, gone. Right, fine. And CPR straight away?
Pretty much.
Pretty.
Within 2 minutes.
Yeah, fine, that's good, great. 1, 2, 3.
The team are preparing to fly Craig. He could go back into cardiac arrest at any moment.
Still breathing for himself, isn't he? So, still not tracing on his saps, no.
CO2 is good, 3.6.
It's come back down, which is good.
Yeah.
Quite high.
Death for medic 2.
Go ahead, Cam.
Quick update on this patient, Matty. We believe it's a 45-year-old male. Witness cardiac arrest, VF. He's had 1 shock and I think 2 adrenalines. We've now got a RUSC. We're just getting a 12 lead just to see what the diagnosis of that is. Our intention is to fly the patient to LGI, either to ED or to the PPCI.
Awesome, mate. That's fantastic news.
It's a plan. What are you? Onto scoop, into flexible,
and onto
takeoff, and LGI. We've got a cardiac arrest for you. Witness collapse, bystander CPR. We have a RUSC. Got him. Yeah, keep going. Kick. The legs need to kick up, Steve. Yeah, it's good to go.
Gav will be monitoring Craig's condition throughout the journey. He knows he could deteriorate at any time.
The guys on the scene have done a really good job there. From speaking to our colleague who was listening to the call, they were instructed on doing CPR straight away, and there was a big group of them all doing CPR. So if hopefully the patient survives, it'll be down to those guys and girls on their bikes who intervened really early with good CPR.
Craig's being flown to cardiac specialists at Leeds General Infirmary. He's critically ill, and no one knows if his 25 minutes in cardiac arrest has caused irreversible brain damage. At the Topcliffe Air Base, paramedic Gemma is on shift.
Hello, Topcliffe.
A call has come in, and she and paramedic Gav must scramble to an unusual case.
Clear left.
Okay, clear 101 out-timers and landing light only.
Airdus 98, lifted Topcliffe, 1 minute to land.
Pilot Owen is flying them to Thirsk, just 3 miles from base. A young patient needs their help.
So where those terrace properties are, it's the big, looks like it's the big house on the end.
Okay, any obstacles we can see?
There were no power lines going through it.
Horses below you.
Okay, got them, mate, no riders. No.
There's a chicken coop and the door is open, but I can't see any in the field.
Oh, help us not take off into us. Right, where's that small tree in relation to you, mate? Is
it's coming up to my 10 o'clock now.
Okay, got it.
Yeah, it's my 9 o'clock now.
Okay, bringing the nose down a bit. Right, 1 skid, 2 skid, a little bit of right wing nose, fine. Fine for nose up, NMI's fine. Thank you, mate. You clear out, guys, if you want to go out to 9 o'clock.
We'll just say it just shut down, mate.
Okay, mate, happy.
We've been told that a 9-year-old boy's got some super glue in his eye. We think there's been a mix-up with some eye drops and they've used super glue instead. We were the nearest resource. It was only a couple of minutes away from our airbase, so we have beaten the ambulance, so we will see what happens.
Hello there, good afternoon. Hi Rupert, I'm Gavin. So what's been happening this afternoon, Rupert?
My dad accidentally put super glue in my eye.
Oh no, you can't see. Can you actually open your eyes or are they stuck together?
Can you open this one?
You can't open the ones. Can I have a quick look at it? Is that all right? Let's have a quick look here. I'm just going to touch on here.
9-year-old Rupert Day can't open his left eye after his dad accidentally used super glue instead of eye drops.
Well, it's stuck together, isn't it? Well, I've only ever seen this once before, quite a few years ago. It happened to a little boy. We took him into the LGI, and believe it or not, the way they actually got his eyes open again was to bathe his eye in full-fat Coke, as in Coca-Cola.
Rupert.
So it's not in our remit. I've got some Coke with me, so we can give it a go. But it works. Obviously, there's that much sugar in there. So if we've got some cotton wool or something, we can put.
Gav's method may be unusual, but the carbonic acid in the fizzy drink can dissolve the glue.
Let's have a look. Ooh, sorry.
You just have to be big brave boy.
Keep your eye nice and closed. You can keep it closed. Keep it closed. That's it. Keep it nice and closed. Can you open it? That's it. Just don't try and squeeze it. Just keep it nice and relaxed. Sorry. Can you open that at all now? Try opening.
I wonder if you can like hold it over it, it'd like dissolve it a bit.
A bit more, just hold it.
It's like magic stuff with Coke in it.
Yeah.
Dissolves everything.
Cures everything.
It makes you just think what it must do to your insides.
Yeah, set your teeth.
Sorry, so you keep your eye nice and closed for me. Sorry.
Can't stop really, because we've got to get this done.
Sorry. What sort of glue was it? Gorilla glue?
Real intensive stuff.
Can you try and open that now?
To glue my boots together.
Can you try again? No? Ooh. Sorry, mister. You've been really brave. Well done.
Have you got the actual packaging by any chance? Like the box?
Oh, sorry. Can you see out the other one? Can you see me with this one? Open that one. Can you see me? Yeah?
Yeah, I can.
Okay. Because it's not going in his eye. This is just trying to take it off the eyelids, you see, and just see if it's the eyelids that stuck. It's the eyelashes that stuck together, aren't they?
Rupert, it's got to work because you've got to be able to see a helicopter in our garden.
Yeah.
Doesn't happen very often.
I want to tell your friends at school, isn't it?
No, not really.
No?
Not really, not today.
Can you open your eyes wide for me? No. Which one's hurting the most?
Still this.
And where's it hurting them? Where's it on the edge of your eye, where your eyelashes are? You point to it. Can you point whereabouts?
About there.
Just on the edge. Yeah, because you can get to the edge. It's the actual eye. It's the eyelashes that are stuck together.
Thankfully, it looks like the glue hasn't got into Rupert's eye itself.
The Coke hasn't really shifted that at all, has it?
It's not done anything, has it? Because you've got this like bit of glue on your eyelashes, it just seems to be sticking your eyelashes together. So I think what we might need to do is take you to the hospital so that they can get it off and Mum or Dad can come. Is that all right? And then we can get you sorted out.
There's an ambulance coming with two members of staff on there, so they'll run you down to Harrogate.
Brilliant, thank you very much.
I'll just check with them first because they're from Harrogate that they'll accept eyes for children.
Dad's in big trouble.
Oh no, yeah.
What are you going to do to get him back?
I'm going to make him buy me a computer.
Oh, that sounds like an excellent plan.
And you normally fitting well? Yeah, apart from your eye? Yeah? Good. And are you allergic to anything? Is there anything you can't have apart from Gorilla Glue? No? Good.
Rupert has had his eyes glued together with a little bit of a mix-up. They thought it was eye drops that they were putting in with an eye problem, and they've actually put a couple of drops of Gorilla Glue into his eye. So he's got his eyelashes stuck together. Quite significant. We've tried to get the glue off using Coca-Cola, which sometimes works, but there's so much glue on his eyelid that just simply hasn't worked. So the ambulance is only a couple of minutes away, and I think that's probably the best course of action is to go to Harrogate Hospital so that they can try and get this glue off and let Rupert see with both eyes.
A helicopter in the garden is a first for Rupert and his family.
Wow. Is that cool? Thankfully, you're not injured enough that you need to go in it.
Are you okay?
Yes.
Are you sure?
I'm fine now. It was as it sunk in. I thought.
Isn't it?
Yeah. The thought because I actually thought the super glue had actually
gone in his eye.
which hopefully it hasn't.
Rupert scratched his eye a couple of days ago, and we were given some eye cream. I went to put it in today, and after I put it in, I realised that I'd picked up the wrong tube and put super glue in instead, like a complete idiot. And we started just putting cold water on and phoned 999, and then they advised us to continue flushing it with water until an ambulance arrived, but we weren't expecting that ambulance. We were expecting something a little bit more mediocre. I'm definitely in trouble. As when I phoned the dispatcher, she said, "Are you Rupert's father?" And I went, "I am at the moment, but probably not by the end of the day."
This young man is Rupert. Yeah. He's at some point today. He's put some. He thinks he's in medication or drops in his eye. What he thought were medication drops in his eye, and he's actually put Gorilla Glue.
Yeah.
So this eye, it wasn't that eye, we've got that's out of that eye, but on this one here you can see there, it's just stuck his eye lashes together. I tried full fat coke, which I've seen done before at LGI, where they bathed it in full fat coke and it dissolved the glue. I got it off, but with this it hasn't worked.
Rupert will be driven to Harrogate Hospital where eye specialists will get to work removing the glue.
Several patients.
Are we attending as the only aircraft over?
Other crew are committed elsewhere.
For Gemma and Gav, though, there's no time for goodbyes. They're being scrambled to another emergency. Near Ilkley, in the shadow of Yorkshire's most famous moor, another of the team's patients is making a miraculous recovery. Craig Parker suffered a massive cardiac arrest during a bike ride with his brother.
It was nothing that made me think I can't carry on with ride, it was just a little bit of discomfort.
Hi there, I'm Gavin. Okay, Gavin. Yeah, your brother now is actually breathing for himself now.
My brother turned round as soon as he realised I were off the bike and on the road. He realised that I wasn't moving, wasn't breathing, so he was shouting for help. Unfortunately, some passers-by on bikes, they came and one of them started CPR. Obviously time were against me, so that was crucial that they stopped to help.
Surgeons opened one of his arteries in his heart, and despite being on a ventilator for 3 days, he did not suffer significant brain damage.
So after the cardiac arrest, I was in intensive care. They did use a cooling technique that brought my body temperature down to enable the brain to recover. They also performed an operation where they fit a stent to one of my arteries, and then it went back down to the ward to recover.
He plans to be back on his bike soon, but there'll be no more smoking breaks. He's given up.
Everybody, my family, friends, everybody will be nervous when I do get back on the bike and start taking regular exercise. I'm a little bit nervous myself, but I just feel ready to overcome that.
Craig knows his situation could have been so much worse, had it not been for the quick-thinking cyclists and the ambulance team.
Everything was stacked in my favour that day. I'd just like to thank all the paramedics, the ambulance crew and the air ambulance crew. They're all absolutely amazing. I'm sure that without them I wouldn't be here today.
Adult non-rebreathe mask. Yep, paediatric non-rebreathe, 2 cap tourniquets.
It's the start of the day at the Nostell Air Base.
And 4 syringe caps.
Inside the hangar, Dr. Andy is ensuring their drugs supplies are well stocked for the next 12 hours. And out on the helipad, paramedic George is on aircraft refuelling duty. But the first 999 call is already coming in.
It's got a packet of frozen peas on it at the moment.
Duty dispatcher Gav is getting the details.
Right, okay. Listen carefully. I want you to locate all amputated parts or skin and place them in a clean bag.
Bloke has chopped a finger off with a circular saw.
He's scrambling Andy and George, with paramedic Matty.
All okay on the left, JB? Roger that. Into the hover, in and out the 30-minute power. Still good left, mate? Check. We're heading into Doncaster area for a man who's been involved in an accident involving a circular saw. We haven't got a huge amount of information. The initial call apparently said that he chopped his fingers off, and Gav, who's on the desk today, said that there was a lot of kind of panic and screaming on the call. So I think an ambulance has just arrived, but we're just obviously been dispatched to see what we can add to help the patient. Things that we're thinking about already on the way are, there's all the immediate life-threatening things that you would think about, and blood loss is a big one. But if we're going to get beyond that, we're starting to think, where does the patient need to be for kind of best management? So where are the hand surgeons based? So we're thinking about that, for which hospital are we going to go into, and what's the best way to get the patient there in the most appropriate time frame.
Right, I've got visual of a DCA now, 12:30 low.
Yeah, I see it.
Right, those wires go along the side of the buildings. If we went, you see there's a little scrubby circle area?
Yeah.
If we aimed for that, we would be clear of the wires. Does that make sense?
Yeah.
area to the right of that little concrete section. Got a tree on the right.
Yeah,
that's all.
You're missing those benches on the left, that's fine.
Cool. That'll be there, landing on.
Gary Ward was cutting some wood when his glove got caught in the saw, pulling in his fingers.
How are we getting on?
He's on board.
All right.
Circular saw, battery powered. It's hanging on by the skin.
Hiya, my name's George. Nice to see you.
I think this guy's at 61, about half an hour ago now, he put his finger on the circular saw. He just cut the slight end of his that finger as well. That finger he cut about 20 years ago, so it's not very
Oh, you're not very good with your fingers then? Oh, mate.
The accident was witnessed by a friend and colleague.
Gary's a joiner by trade. He's been a joiner for 45 years, and we're putting some new doors and architraves and skirting boards on at this house, and he was cutting through the wood, and the wood bounced, and it took the saw out of the groove and went through his finger. He tried to take his glove off, and I could see the finger was hanging on by skin. Got him a clean cloth to bind around his own hand, and just kept it bound, kept him down so he couldn't fall over because he was a bit unsteady on his feet. Until the ambulance crew arrived, and then they took over.
So we're just going to spend a couple more minutes just working out which hospital we're going to go to, all right?
Yeah, I can't afford to lose anymore.
No. Which hand do you write with?
Right, but that's not...
Oh, man. You're really not doing well with them fingers, are you?
I'm right with this now, but that holds all my tools, isn't it? I can't afford to retire, yeah.
No, so give me 30 seconds. Let me just see if we've got a bit of an update for you. We'll get that pain relief ready for you, all right?
Gary's in remarkably good spirits considering his injuries.
At the moment, we're just trying to ascertain what's going to be the best hospital for the patient to go to. There's always a discussion around, do they need to go to the major trauma centre or to the trauma unit? Both are very, very capable of dealing with trauma. Particularly in a case like this, we need to try and make sure that the right specialists are at the hospital for that patient. So we're having a conversation around, are there plastic surgeons and hand surgeons at Doncaster? If you've got a serious hand injury, you want the best possible person to be operating on that for you to get the best outcome, because clearly, you know, your hands obviously are vitally important to you, and so to get the best possible functional outcome, you want the best person possible operating on that and repairing it for you. And that's why we're just having this deliberation now. And given that there's no immediate life-threatening things, it's worth investing 5 or 10 minutes now to get the patient to the right receiving hospital, to get the best possible care, to get the best possible outcome, which at the end of the day is what it's all about.
Right, okay, no worries then. Brill. Thanks for that. Thanks, bye. Go through majors, I said at Donny.
Majors at Donny?
Yeah.
Right, okay.
And I've rung it through, so. Thanks, guys. Nice to see you all. Bye.
The team have decided that the best plan for Gary's care is to take him to surgeons by road ambulance. He'll need a complex operation. It will be a tense few hours for Gary, while hand surgeons try to save his fingers. At the Topcliffe Air Base, more paramedics are getting used to their replacement chopper. Paramedic James has been busy adapting it for Yorkshire's patients.
So we've got this aircraft on loan from Gamma. Our normal aircraft has gone back down to Airbus for its one of its annual services. So they can take anything from kind of 4 to 6 weeks, if not longer, depending on if there's anything that's found with it. So previously we've had to even drop the service down, go down to one aircraft, but we've been fortunate enough to rent in this aircraft from them, which means we can continue to provide the service to the people of Yorkshire.
And it's not long before the new aircraft is put through its paces. Dispatcher James is listening to a 999 call.
Someone's fallen off a ladder in Pickering.
He's slipped off some ladders. He had some scaffolding up, and I think it's just given way and he's slipped off.
Who got dropped for you, mate? It's Pickering.
James is airborne on the new helicopter with paramedic Pete.
DCA's about 10 minutes off.
Roger. We've lifted from Topcliffe in North Yorkshire. We're on our way to Pickering. We're going to a residential address. We've got reports of a 62-year-old male that's fallen off from ladders. I think originally it said that a patient had complained of a hip injury. James has been working trying to get some more information on the air desk. He's just gave us an update that we believe this patient's got some pain around his pelvis. He's fallen about 10 foot off a ladder, which doesn't sound that far, but actually, depending on what you've landed on, there's some potential there for some quite serious injuries. What we're concerned about normally with pain in the pelvis is whether or not the pelvis has been fractured, and if that's the case, you can actually bleed out quite significantly within your pelvis. So if that's the case, we've obviously got the speed of the aircraft. We can obviously take the patient to the major trauma centre, and obviously there's a significant time saving.
The accidents happened in a residential area. Pilot Colin is trying to find the safest place to land close by.
What do you reckon, Pete? This little strip here straight across the allotments? If there's a way over the allotments, there is a big edge there. You want to go this one here?
Wherever you can see, it's not going to get on road, it's fine.
We've got a gate there.
There's sheep moving away from us.
Sheep have done one. This looks all okay. Coming forward and down then. Well landed.
It's just one of those things, built up areas. We just have to put down where it's safe. With regard to this detail, we've seen that there's some of our colleagues on a double crewed ambulance there already, so it just means sometimes that we've got a bit of a walk. So another minute or so we should be on scene and we'll see what's happening. Medic 2 now scene. Hi guys, you alright?
Very good, how are you?
Good, thank you. Right, what's the story?
This is Jeff. He's been up on the aluminium ladder, up at this wood level height,
Okay.
at this window. The ladder has collapsed.
Okay.
Chief complaints currently are right elbow, he appears to have a puncture wound just where Andy's blocking.
Okay.
And also this right hip. You can see he's got some movement.
Moving, yeah.
It is on a lateral rotating position. Left hip is a new hip. The right hip is his own and has been bothered by arthritis only.
So do we think it's more hip rather than pelvis? Happy numbers wise?
Yeah, he doesn't have discomfort when I touch his pelvis. He feels it's more in his buttock and his hip.
Okay. 62-year-old Jeff Walker was doing some work on his roof when the ladder gave way. Local paramedics are giving him gas and air for the pain.
Air desk, medic 2. Yeah, James, very brief update. As passed, 62-year-old male, fallen approximately 10 foot off a step ladder that was on scaffolding. No loss of consciousness. Injuries-wise, he's got a laceration to his right distal humerus, and he's got some pain in his right hip as passed. It's externally rotated. Crew have assessed him currently. They don't think it's his pelvis. We happy numbers-wise? 139. Not beta blocked or anything that might catch us out. He's not on any medication. Okay.
Jeff's wife Julia heard a loud bang from inside the house and found him on the floor.
How are we doing pain-wise?
Not too bad, I suppose.
Can you hold it in that other hand, boss, so we can just have a look at this hand? Is that all right?
Yeah, okay.
Just relax his arm, buddy. So we're just going to pop a little needle in back of your hand, boss, all right? Just that balance at minute. Sorting you out pain-wise, we're keeping you obviously on the floor, not getting too cold, all right?
Yeah, I'm okay.
Sharp scratch coming, buddy, in your hand.
Try and keep your hips as still as you can, though. I know it's hard.
I'm getting a bit chilly.
As soon as I get this needle in, mate, I'll give you some proper pain relief. Okay, keep on with the gas, though.
If Jeff has suffered a hip injury, he'll need stronger pain relief. James needs to get an IV line into his hand to administer morphine.
I'm literally just supporting his arm now.
Not much coming through at all.
Nope.
Tiny.
Right.
You got that?
Yeah, go on.
Is that working, that, or not?
No. Because your hands are cold.
The temperature means finding a vein in Jeff's hand is no mean feat.
Pop tourniquet round there, boss. We'll go with that one. Just open and close your right fist, boss. About 5-6 times, that's it.
Is that your hip again?
Yeah.
Everything.
Right, relax this right hand, boss.
Sorry, I know we're coming at you from all angles, aren't we?
Yeah.
You just relax, take some big deep breaths, and don't go anywhere. Let us do things around you.
Johnny, a neighbour, knows Jeff's a DIY regular. He's never had an accident like this before.
Well, I was just getting out of the car, unloading my vehicle, and I heard the crash, and I knew instantly because I'd just talked to Jeff. I saw him up the ladder, and he said what he was doing, and then I turned my back, and I heard a sudden crash, and I knew straight away. So I came across, cleared a bit of debris, did an initial top to toe, saw the obvious signs, and then told Julie, his wife, to call for an ambulance.
Jeff's pain is getting worse, but thankfully James has managed to get an IV line into his hand.
Right, some good stuff, buddy, all right. We'll give it nice and slowly.
Yeah, how long did it take it to work?
A couple of minutes. We're going to give it slowly, though.
Jeff, if you do happen to pass away, can I have all your power tools?
Yeah.
Okay.
What we're going to do is get you on a stretcher, but to get you onto that, we have to scoop you up.
I will try my best.
Swearing and screaming is allowed, okay?
The scoop stretcher will keep Jeff's spine straight. He may also have a back injury.
Just lift your arm up, boss. You want to come down here, boss? Is that all right?
Yeah.
If you can just, obviously being aware of his hip, if you can just keep hold of his left leg. So I'm going to bring you towards me to start with.
Okay.
Put this arm across.
Big deep breaths as you go. Lots of gas, lots of gas.
That's probably enough, is it? You wonder? Yeah? Your call at the top then.
Everybody got a bit?
Yep. Yep.
On the 3. 1, 2, 3.
The story that he's giving it, actually, it's not just a step ladder. This chap's actually been on a step ladder on top of a scaffolding, and the step ladder's collapsed. Thank you for that. Really helpful. Appreciate that. He has probably come down about 10 feet onto concrete, so he's been quite fortunate, really. We've checked him over. His pelvis seems intact, which is one of the main concerns that we kind of mentioned earlier. But his numbers are all good, so we've supported the crew in giving him some analgesia and obviously put him onto the ambulance, and he'll be going to the local hospital over at Scarborough, and they'll sort his injuries out from there.
Although it looks like Jeff has had a lucky escape, he could still have sustained serious injuries. Only scans at the hospital 16 miles away will tell for sure. It's summer in the Yorkshire Dales, and thousands of people are flocking to its popular walking routes. Among the favourites is Malham Cove, a dried-up waterfall that once dwarfed Niagara. It is visited by over 8,000 walkers and climbers during these months.
Okay, so I need to take some details.
Today, one of those visitors is in trouble.
Yeah, top of Malham Cove, broken ankle. She's at the top. I'll get MRT on route, mate.
Okay, 101. 2 good engines, probably just under 5.5 blues, just above 5.5. Just got the green.
We're off to Malham Cove. It's a really popular tourist spot in North Yorkshire. It's a really nice place actually, but it's in the middle of nowhere. It's quite a long way from the nearest hospital. Today we're going to somebody who's got an ankle injury at the top of the cove. That's all we really know at the moment, so not much details on that. It's popular with people climbing on the rock face, and also people slipping and tripping over on the paths. Often they can end up injuring themselves. What you've got to think about is once you're on the floor and you've hurt your leg or you've broken a bone, you get cold quite quickly. You're not moving around, so even on a nice hot warm day you can get cold and succumb to the elements quite quickly.
And this is Gordale Sky, here is Malham's just over there on the plateau. So what I'm going to do is I'm going to bring the height right down, bring the speed back and see what we find.
There's some people right on the edge.
Where is the actual cove top? Is it
just over there? Look, see
oh yeah,
1 o'clock now.
Yeah, okay. So I'll just come left a little bit and then I'll sweep along to the right once we're...
The main walking path is this one here that goes all the way around, so keep an eye on that.
Right, yeah.
With so many people visiting the cove, the biggest challenge the team faces is tracking down their patient.
99 is overhead Malham. We're preparing to land high once we've got a visual.
Roger, down. She is at the top where the limestone path is.
She is wearing black and green bottoms, and her sister, who is with her, has got a white and brown
jumper on.
I think what I might do is put you down just here where there's a clear area of grass here and let you walk down from there. Right, I don't think I'll get any flatter than it is here, so I'll put it down here. It might be a little bit nose down here.
Yeah, it's a bit of a hill running away backwards.
The team are struggling to find their patient amongst the crowd.
Yeah, where the tree is, the first significant tree, there's a lady in pink to the right who's doing a proper double-handed wave.
Oh, a million miles away.
22 murder. Spoken to informant there's someone approaching now.
Roger, cheers.
Sam and Daz now have a long walk themselves, over the limestone pavement where their patient fell.
A lot of people get excited and wave at us when we're overhead, which is great. But sometimes when we're trying to find a specific person, that can make our job a little bit more tricky in trying to work out who's happy to see us and who's actually needing our help. Hello, you all right?
Luckily, their patient's sister has spotted them.
So what's happened then, Hannah?
Just fallen off one of these, just landed.
Okay.
33-year-old Hannah Ward was walking with her sister Jo on Malham's treacherous limestone pavement, a fossilised riverbed, when she lost her footing and fell.
That's a bit swollen, isn't it? Yeah. Have you got any movement of your foot at all?
I can move it.
Right, okay.
But I actually heard like a proper
crack when you did it?
Yeah.
Have you ever broken your ankle or twisted it before?
I've gone over on them before. Like, I've got quite mobile, like, things like that, but that felt different.
So at the moment when you're not moving it, pain-wise, 10 out of 10 is like the worst pain, screaming in agony, 0 is no pain. On a score of 0 to 10, what would you give it?
It's just like maybe a 5. It's
okay.
Like, I know there's pain there, but it's not.
Yeah.
Well, it stayed.
What about when you move your foot?
When it moves, it just makes me feel sick.
Right. Okay. So, what medical problems do you suffer with?
So allergic to painkillers.
Have you ever had like anaphylaxis?
Yeah, I've got an EpiPen with.
And what have you had anaphylaxis to?
Painkillers.
Which ones?
So non-steroidals and opiates.
NSAIDs and opiates as well. So you can't have any morphine or anything like that.
Hannah's allergies mean that Sam can't give her the painkillers she needs for this kind of injury. He must control her pain and nausea another way.
Your foot's not blue, so that's good.
Yeah.
So as long as when we examine it properly, if we're happy with the circulation stuff, I think you can go in the ambulance to Airedale.
She just actually went over a rock and then slipped, so it just honestly nudged her ankle, and we heard a big crack, so honestly that was it really. So we just came from the edge of Wakeford, and my sister lives in Leeds, so we just drove up to come and see the sights like everyone else does. But yeah, more dangerous than we thought, I think.
Yeah.
Sam's calling out the local mountain rescue team.
You're not going to take her in the helicopter?
No, I don't think so. So if we can have your assistance with this sort of stretcher carry, that would be great.
So although it's not very far, it's just quite tricky terrain to sort of walk over, and mountain rescue will come in force probably, I imagine, to this, and they might be able to get access to the field where the helicopter's actually parked.
Sam and Daz need to put Hannah's ankle in a splint for her journey to hospital. It's a painful procedure. Thankfully, Hannah isn't allergic to Entonox gas.
How are you feeling? Is that starting to work now? Okay, so I'm going to hold and support your leg, and Daz is going to do the other bit. If it's too bad, just take a big deep breath on that, okay? All right. Well done. Okay. Can you straighten his leg out for us, Hannah? Just try and relax it. Can you turn your leg inwards towards me? And that way, can you move your ankle at all that way? Is that too painful? Okay. All right, just nice and still. I'm just going to pop my fingers here. It's a good colour. You've got a good pulse in your foot, and the colour's all normal, okay?
Hannah's observations look good. The biggest difficulty now will be transporting her.
Okay, right, give me a sharp scratch, okay, so really nice and still, don't move, okay?
Mountain rescue, they're going to drive their vehicle into where the helicopter's parked, so we can do a sort of a stretcher carry to there. I spoke to the DCA crew, and they're going to try and make their way around to where the access point is.
So we're just giving Hannah some stronger painkillers, some IV paracetamol. She's got quite a few allergies to different medicines, including some of the stronger painkillers we use, so we definitely don't want to give her any of those at the moment. It's really important that we check allergy status of patients every time we go to give her medicine. In this case, Hannah's allergic to opiates, so morphine's a type of opiate analgesic, so we definitely don't want to give her any of that. If she was to have an anaphylaxis here, she'd be really poorly, and that would make our job a lot more challenging, and she would feel a lot worse as a result of that.
The mountain rescue team have a specialist stretcher for carrying patients across bumpy terrain like this.
So I think the idea is they're going to carry you on this stretcher up to where the Land Rover is by the aircraft, and then they'll drive you over to the ambulance. She's had IV paracetamol on Danzatron. She's allergic to NSAIDs and opiates, and she's like proper anaphylaxis, so
no morphine.
So no morphine. She's had some Entonox as well. Pain was about 6 out of 10.
With her ankle in a splint, Hannah's journey to the ambulance will be more comfortable.
Well, I'm stepping down. I'm stretching down onto the grass. Yeah.
She'll need x-rays when she arrives at Airedale Hospital. It's not the day out the sisters had planned.
Are you okay, Hannah?
Yeah.
How's your pain?
It's all right if I don't move it.
Right, okay.
Sam and Daz are returning to base, but it's probably not their last trip here this summer.
Sorry. Can you open that at all now? Try opening.
Rupert, whose eyelids were stuck together with superglue, spent a few hours in hospital and couldn't open his eye for 4 scary days.
I just had that massive fear that I've blinded my son and I've ruined his life.
I was worried about would it ever open up again or would I be blind in my left eye.
Rupert's eyelashes had to be trimmed down, but thankfully, no glue was found to have gone into his eye.
The doctor was using the tiniest pair of scissors imaginable, but it's effectively like snipping through concrete, so it was a lot of discomfort for Rupert.
Amazingly, Rupert's eyesight hasn't been affected at all.
On the day that my eye opened up, I went on the computer. I could open it and I realised I could see the whole entire view, and I was just like, it's open, it's open! Mum, it's open!
Hello, you all right?
Hannah, who hurt her ankle while walking at Malham Cove, suffered ligament damage.
The injury was a bad sprain and tore ligaments, and I had about 10 days on crutches with mobility and exercises to do to help recovery.
She's relieved she's able to get out walking again, but might give the more difficult hiking routes a miss for a while.
My coping mechanism for a stressful day is to go out for a walk. Just not being able to get around the way that I normally would, that really did impact that time.
How are we doing pain-wise?
Not too bad, I suppose.
Jeff, who fell from a ladder while doing DIY, broke his hip and pelvis, as well as his elbow and wrist.
Sharp scratch coming, buddy, in your hand.
He had 3 operations during his 3-week hospital stay. He's a DIY expert, but he says his ladder failed.
Triple saw, it's hanging on by the skin.
Thankfully, surgeons at Sheffield Hospital were able to save joiner Gary's fingers after he cut them off with a circular saw.
Straight after I had accident, I looked down and I could see my finger cut through but still attached. Felt stupid for doing it, really did.
3 weeks after the accident, he was able to bend his fingers, but he may never get full movement back.
It's going to be a long road to recovery, but with willpower and being able to get back to what I like doing, I think it's going to be well worth it.
He's taking a few months off work and hopes he doesn't have to see the air ambulance crew again.
With the response of the air ambulance, it made me be able to get to hospital and get my treatment quicker to save my finger. Without it, it might have been a different story.